Well, Dr. Welch, you're focusing on breast cancer, metastasized breast cancer. Can you talk about how did you get interested in that area?
Well, for a lot of different reasons, but I do want to kind of backtrack from that. I study how cancers metastasize.
Mm-hmm.
So if you look at any cancer, the reason people die is because of metastasis. The reason they experience pain or all the side effects are due to metastasis. And what I've understood more with time is that understanding metastasis in any disease, any cancer, helps understand it in another. Not the same, but they're close. With regard to breast cancer, my mom had told me that of her other 6 sisters, they'd all had some form of breast cancer.
Wow.
And my mom never had breast cancer. She did die of metastatic cancer, but that was a motivation to begin studying it. And also, I have had the privilege of working with a lot of people like yourself, patient research advocates, who have really helped formulate what's going on and help put real focus on things. I like to think of myself as understanding about cancer, but I've never had cancer. And studying it in mice or in a test tube is not the same as what you've experienced as a survivor or anybody else. And the women who've helped lead the National Breast Cancer Coalition and so on helped raise awareness of what real cancer is. And so that's continued, and I was involved in helping train a few of the early research advocates because they sat next to me at study sections and things. And we've developed bonds that have lasted 20 plus 30 years.
So. Great. Well, there certainly is a lot of impetus even for me, certainly as a survivor, but also meeting so many women who have had either breast cancer, but then breast cancer that has metastasized. And we're going to feature a couple of them in Allison's Allies, and just visiting with them, and I think, okay, you guys are fighting a battle every day. Even though very positive attitudes and really trying to approach this well, but while they have some treatments, they know that there's an eventuality to this whole process.
I often like to think of it as correcting people when they say metastatic cancer is not curable. Well, I'd like to add not currently curable. And when I started grad school, no woman diagnosed with metastatic breast cancer survived 5 years, statistically. I now have friends who are 20 plus years out with metastatic disease. They still have all of those daily challenges, the anxiety, the every aspect of the disease and the side effects, the chemo that has longer lasting effects than when you're taking it, and all of those things. It's troubling, but they're alive. They've seen their kids grow up, and so on. We're not doing as well as we need to be, but we're doing a lot better than we used to be.
Yes, making progress. Not there yet, but continuing progress. That's what's so important.